Lantus is a man-made form of a hormone, insulin, that is produced in the body. Insulin is a hormone that works by lowering levels of glucose sugar in the blood. Insulin glargine is a long-acting insulin that starts to work several hours after injection and keeps working evenly for 24 hours. Lantus is used to improve blood sugar control in adults and children with diabetes mellitus. Lantus is for use in adults with type 1 or type 2 diabetes and in children at least 6 years old with type 1 diabetes. For type 1 diabetes, Lantus is used together with short-acting insulin given before meals. Some brands of insulin glargine are for use only in adults. Carefully follow all instructions for the brand of insulin glargine you are using. Indications. Lantus is indicated to improve glycemic control in adults and pediatric patients with diabetes mellitus. How to use. Always check insulin labels before administration. Visually inspect Lantus vials and Solastar prefilled pens for particulate matter and discoloration prior to administration. Only use of the solution is clear and colorless with no visible particles. Administer Lantus subcutaneously into the abdominal area, via or deltoid, and rotate injection sites within the same region from one injection to the next to reduce the risk of lipodystrophy and localized cutaneous amyloidosis. Do not inject into areas of lipodystrophy or localized cutaneous amyloidosis. During changes to a patient's insulin regimen, increase the frequency of blood glucose monitoring. Do not administer intravenously or via an insulin pump. Do not dilute or mix Lantus with any other insulin or solution. The Lantus Solastar prefilled pen dials in 1 unit increments. Use Lantus Solastar prefilled pen with caution in patients with visual impairment who may rely on audible clicks to dial their dose. Administer Lantus subcutaneously once daily at any time of day, but at the same time every day. Individualize and adjust the dosage of Lantus based on the patient's metabolic needs, blood glucose monitoring results, and glycemic control goal. Dosage adjustments may be needed with changes in physical activity, changes in meal patterns, macronutrient content or timing of food intake, during acute illness or changes in renal or hepatic function. Dosage adjustments should only be made under medical supervision with appropriate glucose monitoring. In patients with type 1 diabetes, Lantus must be used concomitantly with short-acting insulin. The recommended starting dosage of Lantus in patients with type 1 diabetes is approximately 1/3 of the total daily insulin requirements. Use short-acting premeal insulin to satisfy the remainder of the daily insulin requirements. The recommended starting dosage of Lantus in patients with type 2 diabetes who are not currently treated with insulin is 0.2 units per kilogram or up to 10 units once daily. Dosage adjustments are recommended to lower the risk of hypoglycemia when switching patients to Lantus from other insulin therapies. Contraindications. You should not use Lantus if you are allergic to insulin or if you are having an episode of hypoglycemia, low blood sugar, or diabetic ketoacidosis. Call a doctor for treatment. Lantus is not approved for use by anyone younger than 6 years old, and some brands are for use only in adults. Don't use this medicine to treat type 2 diabetes in child of any age. To make sure Lantus is safe for you, tell a doctor if you have liver or kidney disease, or heart failure or other heart problems. Tell a doctor if you are also take pioglitazone or rosiglitazone, sometimes contained in combinations with glimepiride or metformin. Taking certain oral diabetes medicines while you are using insulin may increase your risk of serious heart problems. Tell a doctor if you are pregnant or breastfeeding. What should I avoid while using Lantus? Avoid driving or hazardous activity and you'll know how this medicine will affect you. Your actions could be impaired. Avoid medication errors by always checking the medicine label before injecting your insulin. Avoid drinking alcohol or using medicines that contain alcohol. It may interfere with your diabetes treatment. You should not use Lantus if you are having an episode of hypoglycemia, low blood sugar, or if you are in a state of diabetic ketoacidosis. Call a doctor for treatment. Lantus side effects. Get emergency medical help if you have any signs of an allergic reaction to Lantus, redness or swelling where an injection was given, itchy skin rash over the entire body, trouble breathing, fast heartbeats, feeling like you might pass out, or swelling in your tongue or throat. Call a doctor at once if you have rapid weight gain, swelling in your feet or ankles, shortness of breath, or low blood potassium, like cramps, constipation, irregular heartbeats, fluttering in your chest, increased thirst or urination, numbness or tingling, muscle weakness or limb feeling. Common Lantus side effects may include low blood sugar, swelling weight gain, allergic reaction, itching, rash, thickening or hollowing of the skin where you injected the medicine.